Hello, my name is Dr. Brandon Gardner. I'm a general dentist here in Boerne, Texas, and today my guest is Dr. Richard Hulme. Dr. Hulme is a board-certified orthodontist who practices in San Antonio. He has 4 offices in and around the San Antonio area, has treated thousands of cases. He's an excellent clinician and a great friend of mine. Today we'll be discussing a newer segment of orthodontics known as clear aligner therapy. And you may never have heard of clear aligner therapy, but you have probably heard of Invisalign. And Invisalign is a specific brand of clear aligner therapy. Dr. Hulme, welcome. It's great to have you here today.
Thanks, Dr. Gardner. It's good to be with you too, and I'm glad you called me a friend. You've been a friend of mine for a long time.
We've known each other for quite a while.
Yes, we have.
So tell me, what is clear aligner therapy, or what is Invisalign? We'll just talk about it as Invisalign today. What is Invisalign?
No problem. So orthodontics or braces has been around for over 100 years, and it uses fixed appliances, we call it, which are things, brackets and wires and bands that are glued to your teeth temporarily but permanently for the time that you're in treatment. This is Invisalign or clear aligner therapy is something that's been around in some form or another for well more than 20 years. And Invisalign has been in business for at least 20 years, maybe 21. The idea is that it's different than fixed braces. It is removable clear aligners that are all very closely shaped to the shape of your teeth, but slightly straighter than your teeth are, so that by wearing a series of them, you progressively straighten your teeth from crooked to straight over a period of time, kind of like braces. The advantages are they're removable, so you can take them off to eat, you can take them off to brush, you can wear them while you're playing sports and not worry about hurting your lips like you might with braces, and obviously being clear, they're quite invisible, so they're much more aesthetically pleasing than braces traditionally.
Awesome. So you highlighted some of the key differences and kind of a little bit about the history. Maybe tell us a little bit more about the differences between traditional orthodontics and Invisalign. I have a lot of patients asking me, well, does this work just as well? Does it take as long? Does it cost the same? What are some of the key differences?
Gotcha. So probably what I could say is that as clear aligner therapy is becoming more established, and as they are doing more research and development, and as we're treating more and more cases, I believe Invisalign just hit their 6 millionth case. As we're doing more about that, we're learning better how to use Invisalign in similar ways to the way we use braces. I would say that there are maybe 20% of cases that Invisalign actually does better than braces, 20% of cases where braces does better than Invisalign, and the remaining 60% are roughly equal between the two. And that's something that I wouldn't have said even as recently as 5 years ago. So the technology is getting better, and our knowledge of how to use it is definitely improving. One of the things that has really happened recently is that Invisalign in particular, of all the clear aligner therapies, is definitely the one that has the most history, the most success, the most treatment, the most research and development. So it's the only one that I use. And it's the one that I think is the best currently in the market and is positioned to do very well in the market going forwards. In terms of what it can do, there are some things that is definitely easier to treat with braces, like moving the roots of teeth. For example, we want to straighten teeth so that they look great, but we also want them to be healthy in terms of the bite, in terms of the gum and bone tissue around the teeth. And sometimes if you need to move one root away from another root, so root of one tooth away from the root of another tooth, using braces might deliver the force to that tooth a little more efficiently. I know that's getting kind of into the weeds, but the point is there are some things that braces definitely do better, but the vast majority of things, straightening teeth that are just a little bit crooked, even fixing some overbites and underbites as long as they're relatively mild, are very successful with Invisalign. And these changes Invisalign's made recently that are patient and doctor friendly allow us to, again, not only charge the right amount, so less cost for less difficult treatment, but they also make it so that you can go through more trays in the same amount of time. They make it so that you can go through multiple treatments for the same cost if you need it, all because Invisalign, I believe, is trying to make sure that you can get the same quality result out of Invisalign for most cases that you can out of braces. And that's why even I'm, as an orthodontist, feel like it's a good treatment option for most of the patients that come into our practice.
So based on what you said there, I talk to a lot of patients that have the perception that maybe Invisalign is meant for just, if your teeth are just a little bit crooked and there's not a lot going on. But it sounds like as time has gone on, that Invisalign is really becoming a tool to treat, you know, the majority of cases. I guess a lot of cases. I'm thinking, what kind of person would this be a good fit for? And it sounds like, you know, really it could be for most of our patients. Is that right?
I think that Invisalign's really trying to position themselves as a full service option for orthodontic treatment. I still feel like there's going to be a limit, that they can't do certain things. Pre-surgical, with somebody needs jaw surgery in addition to their braces, might be an example of where it would be difficult. Another one is you have to be very disciplined to wear the Invisalign, right? Braces, you don't really have a choice. You can't really take them off before the orthodontist takes them off. But with Invisalign, you have to take them on and off several times a day. Take it out for breakfast, put it back in, take it out for lunch, put it back in. So sometimes patients who might be a little less diligent about that, like your younger patients, kids, might not be as good of a candidates. But I'll tell you, sometimes our teenage patients are so determined to prove their parents wrong, that they end up being our best wearers. And half teasing, sometimes dental professionals tend to be the worst. You know, we kind of are, it's easy for us to tell patients what to do, and sometimes it's hard for us to kind of keep those same rules ourselves. So I'm kind of joking a little bit there, but the point is, it really does come down to, are you the right kind of case? Is the kind of treatment you need easy enough or predictable enough that it's going to be successful? Are you diligent enough and cooperative enough that you're going to do it? And again, my little rule of thumb is, if you're paying for it, you're probably going to wear it. And if you're not, like a teenager, maybe you're going to have a harder time. But again, you could be proven wrong. You know, those are some of the things that I think about in terms of who's a good candidate for it. But yeah, I think that every year the Invisalign comes out with more and more research and development, more and more tools for the orthodontist to treat the case better, and they're able to expand the kinds of cases we're able to see to almost as many cases as we want. Sometimes I literally have a patient who comes in and says, if I don't use Invisalign, I won't straighten my teeth. And I'm stuck with the choice. Well, I can use all of my skill and experience to give them the best result possible with Invisalign, or I can say, you know, you need to go somewhere else or not get treatment. And that has helped me kind of push my clinical abilities to try to make sure that I'm able to treat as many cases as present to me.
That's, you know, I'm glad you brought up that point about adolescents and adults, because really it's not that Invisalign couldn't be a good tool for adolescents, but it's that, you know, are they going to comply? Are they going to wear it? And if you're not paying for it, you may be a little less apt to be committed to the process.
Right.
Go ahead.
So for some patients where it's maybe difficult for them to be compliant, one of the advantages of going to an orthodontist is that we do have other options like braces available. So sometimes parents will kind of be worried about starting their teenager on Invisalign, and we assure them that if they do decide to switch from Invisalign to braces, that we make it affordable for them. You know, it's a small cost difference just for the cost of our braces, not for a whole cost of treatment or something like that. But I think that even a general dentist who got started with Invisalign cases could expand their ability to treat those cases. And worst case scenario, if somebody's not compliant, then they have an orthodontist friend that they could refer them out to be able to finish their treatment. And we could make that kind of seamless, you know?
Yeah. So if we had a patient who dislikes their smile, they want to straighten their teeth, they're thinking about Invisalign, they're interested in it, what would be a great next step for that patient?
Great question. So one of the nice things about Invisalign is that it doesn't require what it used to require, which was goopy impressions of your teeth and time-consuming procedures to be able to kind of submit that off and get back kind of the initial setup of what the case might look like. Nowadays, we have something called iTero, which is an intraoral 3D digital camera scanner system, and it doesn't take the impression system, and it's a 6 or 7 minute process to get a 3D virtual model of your teeth. And literally at a click of a button, within about a minute and a half, we can get what we call an outcome simulator for you. So to come in at no cost, you could get the initial scan and the initial outcome simulator done all at no cost, and really kind of try it before you buy it and see whether or not you're a candidate. First of all, how long the treatment might take, what it might cost, and really have kind of a face-to-face encounter talking about what the life of an Invisalign patient is like. So that's the best way to start. And again, very low risk, no cost, no obligation.
It's phenomenal, that outcome simulator you mentioned, to be able to see just in a few minutes kind of a before and after, and it gives our patients that ability to see very quickly, oh wow, this looks great. I mean, if we can get anywhere close to this, I'll be very happy. And it's a neat.
Yeah. I'll tell you this, Invisalign's pushing the technology with artificial intelligence so much. That's what they use for the outcome simulator. It used to take us maybe 2 weeks to get what we call a clin check, the initial clinical checkup of what the case would look like. It is now down to about a day, but they're pushing to try to get that done in 5 to 10 minutes, which would mean you could have that done while a patient is at their appointment. And so not only getting kind of a rough estimate, but you could really get what Invisalign commits to in terms of how many trays or how long it would take to get your treatment done. So again, it's just amazing how much information they can give you for free, no obligation. Invisalign doesn't charge the doctor, doctor doesn't have to charge the patient. They can get all of that information within a relatively short period of time with hardly, any kind of intrusive kind of procedures.
Yeah, that is really cool. You mentioned trays. Last question: what, in your experience, how does the timeline of Invisalign look compared to the timeline of traditional braces? How long is it? Shorter, longer, about the same?
Great question. I would say that it's similar to that earlier answer of 20% shorter, 20% longer, and 60% is about the same. And I'm not just trying to wuss out, and I'm not just trying to throw statistics out there, but I really think that that's pretty accurate to what it is. It's kind of that 80-20 rule, kind of in a sense, on both sides. I would say that with Invisalign's ability to let patients wear trays just 1 week each. And again, this may not mean anything to anybody, but for the first 15 years they were in business, they advocated 2 weeks per tray. They now have research and development from a very significant study of 200,000 patients, tons of patients, where they concluded that 1 week per tray versus 2 weeks per tray yielded the same results. So with that, we can go through twice as many trays in the same amount of time, or the same number of trays in half the time. So depending on the case, again, I really think we're getting close to being able to yield the same results as I can get with braces, again, in that 60 to 80% of the cases in the same amount of time or even shorter.
Yeah, that is awesome. That is pretty cool, the way it's evolving with technology. Well, Dr. Hume, thank you so much again for your time today. If you'd like to learn more about Dr. Hume or his practice, he can be found online at Hulme Orthodontics. Their website is humeortho.com. And again, I'm Dr. Brandon Gardner here at Gardner Springs Dentistry. Thank you.